Well, here to give his thoughts on the health budget is statistician and political commentator Jamie Jenkins. Jamie, good morning to you. Thanks for joining us. I mean, surely the government could have allocated more money to the social care sector if it hadn't blown it all on the failed NHS test and trace system. I mean, let's start there, shall we?
No, Kirsty, I think you're probably right there. We've obviously had a huge investment in the NHS with the unprecedented pandemic. I think what the Chancellor's announcement yesterday is trying to address is these kind of growing waiting times. And we've seen them obviously go up through the pandemic. But I think one of the things that we need to obviously focus on as well is that kind of waiting times for the NHS were at the lowest point around January 2009, where there were 2.3 million people on waiting lists. And they actually grew to over 4 million before the pandemic. So I think the last 10 years of kind of spending cuts where we've seen kind of increases in waiting times, this is probably going some way towards addressing some of those issues. I think what some people will say as well, though, is that it's all very well pumping lots more money into the NHS. The real critical problem I think we've also got is you've got to have the staff, and you can't, if you just give more money to the NHS overnight, you need time to train staff. We know we've got fewer GPs per head population compared to some EU countries, fewer beds in the NHS hospitals compared to some EU countries as well. So money's obviously going to be welcome, but it's just not going to fix things overnight. Just having the finances, you need to have the staff as well.
I mean, having touched on the test and trace scandal, actually, I'll call it that. There is a concern that with all this money being put into the NHS, that the issue of waste hasn't gone away, that we can't guarantee that every pound goes where it should do.
No, Simon, I think you're spot on there. There's a huge amount of money that goes into the NHS. You look at the test and trace system where we're hearing stories of consultants earning £1,000 a day, and the problem with outsourcing some of this kind of stuff, especially with the test and trace system as well, is that once you've outsourced this information, kind of the work elsewhere, when the thing kind of comes to an end, you lose all that kind of knowledge as well. We were promised a world-class kind of test and trace system, and it didn't really do what it was supposed to do, and that's what the criticism has been labelled at the government this week, because we continue to see lockdowns, we continue to see cases going up, and you hear stories of people who haven't been contacted, and then we had obviously the pandemic through the summer months as well with the NHS app. So you could say it's been a bit of a failure overall, that one, and it's been very critical of government. And you're talking of a budget of over 37 billion there. I think the real critical thing is that it's all very well putting money in. You've got the social care issues as well, because we know at the moment you've got issues of getting people out of hospital back into the social care system. It's kind of will be blocking beds this winter. I think the real critical thing is as we go into the winter months, because the budget and the extra money will help in the future, is how are we going to cope through kind of the winter months? And we know that prior to the pandemic, the NHS was always overrun throughout the winter. So it's not going to be no surprise that I think some hospitals are already saying that they're kind of under pressure at the moment.
Well, I was just going to say, you touched upon it there, but this backlog that we talk about, those treatments that people are waiting for, appointments, etc. I mean, with these rising COVID cases that we're now seeing and expected to see more in the coming months, we're I guess, going to see further delays for patient treatment, aren't we?
It wouldn't surprise me with that. It seems to be the first thing that gets cut, obviously, is when we see rising admissions into hospital or kind of the non-COVID patients. And we got to remember, this is the National Health Service for everybody. I suppose the good news is, and the modelling is suggesting now, that because we've obviously got significant antibodies in the population now, we're probably not going to see what we saw last winter, this winter, where we saw a huge influx in patients. The number of patients in hospital, Kirsty, at the moment is about a quarter of what it was at the peak last winter, and we're not expected to get anywhere near what we saw last winter. I think the tsunami that we've got in the NHS at the moment, though, is not just the fact that we got a huge amount of COVID patients. They are a lot lower than they were. I expect them not to rise anywhere near what they were. It's just that we've now got all the backlog of patients who didn't come forward through the pandemic because obviously they were staying at home to protect the NHS. They've been coming forward, and the NHS just is struggling to cope with the tsunami of both sides of things. And it just seems to be that, let's say, COVID cases, if they do go up, it seems to be the non-COVID patients that suffer.
OK, well, thank you very much indeed, Jamie Jenkins.